Do you often feel like your body is tired? Or maybe you catch colds much more often than others? What if your immune system, the body's defense team, was missing some of its most important soldiers? That's what happens in bare lymphocyte syndrome (BLS). Imagine your immune system is like a security team guarding a big castle, your body. In BLS, some key guards, called T cells and antigen-presenting cells, don't show up for duty because the castle forgot to send them ID badges, called MHC molecules. Without these IDs, the guards can't recognize enemies like viruses or bacteria. So infections keep breaking in, again and again. This rare disease usually shows up early in life and weakens the body's ability to fight even simple infections. What causes this missing security team? It's not germs or dirty water, it's actually in your genes. Think of genes as instruction, manuals your body uses to build and run itself. In BLS, there's a typo in the manual, specifically in genes like CIITA, RFX5, RFXAP, or RFXANK. These genes help make the ID badges, MHC molecules, for immune cells. When they're broken due to inherited mutations from both parents, the badges aren't made. So even though T cells are present, they can't be activated. It's like having a fire alarm system, but the sensors aren't plugged in. This is a genetic disease, meaning it's passed down at birth, not caught from someone else. How would you know if someone has BLS? Let's play detective. Picture a baby who keeps getting lung infections, like bronchitis or pneumonia, even when kept clean and well-fed. Or maybe a child who has chronic diarrhea or skin infections that just won't go away. These aren't just bad luck, they're clues. Other signs: swollen lymph nodes, slow growth, or fungal infections in the mouth. Since the immune system can't respond properly, even weak germs become serious threats. If your friend constantly gets sick while others stay healthy in the same classroom, it might be more than just weak immunity, it could be BLS. How do doctors find out? First they ask, why won't these infections stop? Then they run special blood tests. One test checks if immune cells have MHC molecules, like scanning for missing ID badges. Flow cytometry is a machine that does this by tagging cells with glowing dyes. Genetic testing follows to find the exact typo in the DNA. Treatment isn't a simple pill. The best cure right now is a stem cell transplant, replacing the entire broken immune system with a healthy donor, S. It's like swapping a faulty computer motherboard. Before that, patients get antibiotics to prevent infections, IV immunoglobulins, antibody boosters, and protective isolation. It's a tough journey, but early diagnosis can be life-saving. Can we stop BLS before it starts? Since it's genetic, you can't avoid it like a cold. But let's say both parents carry a hidden faulty gene, like two people who unknowingly have a typo in the same page of their manual. If both pass it to a child, BLS can happen. So, prevention starts with awareness. Genetic counseling is like having a guidebook before having kids. Couples with family histories of immune diseases can get tested. Prenatal testing or newborn screening in high-risk families may catch it early. Think of it like checking a car's engine before a long trip, better to fix issues early. Science is moving fast. Researchers are experimenting with gene therapy, fixing the broken instruction manual inside the patient's own cells. Imagine editing the typo in the gene and sending the corrected cells back. No donor needed. Trials are ongoing, especially for type 2 BLS. Also, better stem cell matching and safer transplant methods are improving survival. Some labs are growing immune cells in dishes to test new drugs. While not all cures are here yet, hope is growing, like planting seeds for a